Hi there. Hi. How are you doing today? Good. I'm glad to hear that. Yep, just come on in. Oh, if you don't mind just closing the door. Perfect, thank you so much. Okay, just take a seat. So, are you here for your annual physical exam today? Good, I'm glad to hear it. Okay, so my name is Dr. Periwinkle. I've been working at this clinic for about a year now. I don't believe I've met you before. But it's really nice to meet you. Okay, so if I could just start by taking your name and date of birth. Perfect. How do you spell that? Okay. Okie dokie then. Okay, so do you remember approximately when you last had your physical exam? Was that at some point last year? Okay, so around October. Perfect, okay. So you're not actually due at the moment, so is there a reason why you wanted to come in for another physical exam not too long after the previous one? Okay, so you've got some concerns you wanted to talk about. That's fine, we can definitely talk through anything that is worrying you. Okay, so this is your time. Okay, this is probably gonna be at least an hour. Okay, we have plenty of time. We'll go through everything bit by bit. Okay, make sure we complete all of the checks and make sure that we talk through all of your concerns. So I want you to feel comfortable. Not gonna rush you. Okay, we'll take it slowly. And I just want you to feel like this is a safe place where any concerns that you have, we can talk through. Okay, so you're just a bit anxious about your health overall. Okay, not to worry, because I promise we will do a very thorough, detailed examination. So when you walk out of the room today, you'll be clear on whether everything is normal and healthy or whether there are any problems that might need some further testing. Okay? Perfect. If we can begin with a few questions, okay? So, do you have any allergies? Okay. Is that a serious allergy? So, what would typically happen to you if you were to come into contact with it? So rashes, okay. And are you generally finding that you can avoid it quite easily in your everyday life? Okay, that's good. Okay, so are you taking any medication currently? Yeah, okay. Could you just talk me through what you're taking, what it's called, what you're taking it for, and what times of the day? Yep, okay. And what's that one for? Fine, okay, that's fine. Would you say that these medications are working for you? Are you happy to continue to take them for the time being. Okay, good. Alright, so let's just talk a little bit about your lifestyle. So we'll begin with your sleep. How would you describe your sleep? How many hours of sleep are you getting a night? Would you say that it's restful, or would you say that it's kind of disturbed, broken? Okay, 6 hours. Okay, so you probably know this, but we generally do recommend closer to 8 hours. Is there any particular reason why you're only getting 6 hours? Is it to do with what time you go to bed, or what time you wake up, or would you say that you have trouble staying asleep for the whole night? Okay. Right, so to help you get off to sleep at night, I do have a few recommendations if you're interested. Okay, have you ever heard of ASMR? So it stands for Autonomous Sensory Meridian Response. It's quite a popular phenomenon nowadays, although it's been around for a long time. It's becoming quite popular. So basically, what it really is relaxing. It's a relaxing feeling, often elicited from watching certain videos, such as videos on YouTube. So if you was to go to YouTube and type in ASMR, you would find some of these relaxing videos, and people generally find that they can fall asleep quicker and stay asleep longer when they watch these videos at night time. So that's worth a try. You happy to give that a try? Perfect. Okay, let me know how you get on with that. Okay, so how is your diet? Would you say that you're fairly healthy or not so healthy? So if we put it on a scale of 1 to 10, 1 being not healthy at all, 5 being 50-50, and 10 being very healthy, whereabouts would you put your diet? A 6. Okay, so you're over the halfway mark, so that's a good start. What would you say is bringing you down a bit? What could push that number a bit closer to 10? So you do get lots of fruit and vegetables? Good, I'm happy to hear that. So what is the problem that's keeping you from achieving a 10? You like to snack? Okay, that's quite normal. Don't worry, that's quite normal. What do you normally snack on? Biscuits, chocolate, okay, that kind of thing. Okay, that's fine. Everything in moderation. I would never recommend that you cut anything out of your diet completely. I would say just limit to maybe 1 or 2 snacks a day. Maybe perhaps if you're going to have a few biscuits, just have a few less biscuits. If you're going to have a chocolate bar, have a slightly smaller one, or just a few squares of chocolate. Usually it's about the taste to kind of satisfy that need for chocolate, and you don't need to eat a huge amount of it. Sometimes just a few squares of chocolate is enough to satisfy that craving, You know what I mean? And actually dark chocolate, you only really need 1 or 2 squares, and it really does. It's definitely worth trying. I find that it really does satisfy that craving for chocolate. Okay, so just about kind of cutting things down gradually. I would never say cut anything out completely. And you can gradually kind of make healthy swaps. So maybe slightly less chocolate and maybe an extra piece of fruit throughout the day, or maybe some nuts. Okay, great. So fluid, are you getting quite a good amount of water in your diet? Well, tea and coffee do count. Juice and squash and smoothies, it all does count, but I would recommend just pure plain water as much as possible. Okay? What about your physical activity in terms of your exercise? So usually exercise is in 2 parts. You've got cardiovascular activity, walking, running, cycling, swimming, etc. And then you've got the kind of muscle toning, so lifting weights and body weight exercises. Do you do anything like that? Okay. So you do go to the gym. Good. How often? Twice a week? That's quite good. That's definitely more than me anyway. Is that something that you're able to maintain quite easily? Fantastic. And do you do a mixture of muscle building, weight bearing exercises and cardiovascular exercises? You do? Okay, perfect. Have you had any illnesses or injuries since you last saw your doctor? So quite a lot of people have been getting colds and flus over the past couple of weeks to the past couple of months, really. Kind of before Christmas up until now. I've noticed that it's quite a persistent cold, one that is sticking with people for a good couple of weeks, and people are finding it hard to shift. So have you been caught out by that, or have you managed to avoid it? Okay, you've avoided it so far. That's good to hear. So I would just say to keep avoiding it, I would probably say increase your intake of vitamin C. Of course, you've got oranges, red peppers, all kinds of brightly coloured fruits and vegetables are likely to have vitamin C in them. If you're not really keen on that, you can take supplements, okay? Yeah, it just really kind of builds up your immune system and helps to fight off those infections. And of course, just washing your hands regularly, and if you're around people who are sick, if they're going to be coughing and sneezing, just keep a bit of distance from them. Okay? Yeah, hand sanitizer, that's a good shout as well. Alright then. Any pains throughout your body at all? So any pains in your arms and legs, or any pains in your abdomen, or in your chest, or any pains in your head? Okay, good. How about back pain? I know that back pain is quite common. do for a living, if it's okay to ask? Do you do lots of heavy lifting? You work at a desk? Okay, so heavy lifting, not really part of your job. Okay, good. Do you find yourself seated in a chair for most of your working day? Okay, I'd say if you're able to, maybe once an hour, I'd say get up from your desk and just have a walk around. Little bit of a stretch, kind of little bit of a twist. Just keep yourself moving. Yeah, because if you sit in the same position for hour after hour after hour, you can get stiff and your back is gonna start to ache. Okay? So yeah, just try to keep moving. Did you have anything else that you wanted to talk about? Or shall we move on to the inspections and the tests? Okay, we'll move on. If you do think of any questions at all, please don't hesitate, just ask me, even if it's not relevant to the test that we're doing at the time. If a question pops into your mind, just ask it. Okay? Perfect. Alright, so the first test is just a general inspection of your body. So I'm going to look at your arms and your torso mostly, just for any kind of lumps and bumps, abnormal growths or skin issues, okay? So if you could do me a favour and just roll up your sleeves, okay, a bit like me. Okay, good. I'm just going to be feeling along your arms, if that's okay with you. Perfect. Just hold out this arm for me. Okay. Alright, all feels quite good. Yep, the skin is quite smooth, quite clear. Nothing to worry about there. Let's have a look at the other side. Okay, good. That's fine as well. If you wouldn't mind either unbuttoning your shirt or lifting it up, I'd just like to have a look at your torso, kind of your stomach, your chest. Just gonna be having a bit of a feel, kind of tapping on your skin, just have a feel of the organs inside, okay? Alright, good. Yep, that's it. Yep, just gonna be tapping along your stomach. Good. The other side. So this is where most of our vital organs are, right kind of behind your abs. Do you have any pain, any discomfort, any sensitivities in your stomach area? No? If you don't mind, I'm just rubbing along your stomach, okay? Quite firmly. Can you feel that? Good. That feels fine, okay? Yeah, you can button up. You're all good. Nothing to worry about there. I couldn't notice any important parts of a physical examination, okay? Because your heart and your lungs really are so vital that they need to be in perfectly good working order in order to be healthy, okay? So we'll do your heart first. So I've got a stethoscope here. Right, and what I'm going to do, I'm sure you've seen this before, have you? This bit, it's quite cold. It's going to go on your chest where your heart is. Okay, I realise that I did just tell you that you could button up again. I'm going to have to ask you to undo the top couple of buttons. Okay, so this is cold, so I'll just warm it up. Okay, and what I'm going to do is just have a listen to your heart, and I'll just be counting the beats, okay? If you could just stay quiet and just breathe normally, naturally, don't hold your breath and don't do any deep breaths either, just normal breathing, okay? Try and stay relaxed, try not to tense up, okay? So I'm just gonna do a little bit of a count for about a minute, okay? Good. Alright. Good. Yep. I hope that's not too cold. Good. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, Okay, we'll stop there. So that was about a minute, okay? So I counted 66 beats for the minute, which is very healthy. Okay, so you have nothing at all to worry about there. I know that you said that you were a bit concerned about your heart, but I can assure you that your heartbeat is perfectly within a normal range. Okay? Yep, anything kind of between 60 and 100 is normal. Obviously, the lower the better, and kind of the younger you are and the fitter you are, the lower it's gonna be. But yours was absolutely brilliant, all things considered. So I hope that puts your mind at ease a bit. Perfect. Okay, so if we move on to your lungs, can I just ask you, are you a smoker? Okay. Do you smoke e-cigarettes or vapes? Okay, right. so I'm just going to bear that in mind. Just going to have a listen to each lung. Okay, so we'll do it one at a time, and I'll ask you to just breathe normally at first, and then I'll ask you to take a couple of deep breaths, okay? And I'll just be listening to see if your lungs are clear and healthy, and if they sound like they're functioning really well, okay? Perfect. So, should we do this side first? Okay. That's it. Perfect. So if you just breathe normally. Good, that's fine. If you could take a deep breath for me, breathe in as deep as you can through your nose, and then exhale slowly through your mouth. Okay, good. If you could just do that one more time. Fantastic. Okay, let's switch and have a listen to the other side. So just breathe normal. That's good. That's good. Okay, if you could just take a deeper breath, just like we did before. Breathing in as deep as you can through your nose, and exhale fully through your mouth. Perfect. One more time. That's it. That's perfect. That sounded fine. So there was no wheezing, rattling, anything like that would indicate fluid or blockage. Nothing like that. So your lungs seem to be healthy and clear. So I hope that puts your mind at ease. I hope you feel okay about that. Okay, so if we could just take your temperature. I've got one of these oral thermometers, a bit like they have in schools. I'm not sure if you remember. Okay, so what I'm gonna do is ask you to just open your mouth and poke your tongue out, and I'm just gonna be popping it underneath your tongue, okay? Perfect. Perfectly clean, so don't worry. This actually measures in both Celsius and Fahrenheit. So which do you prefer? I normally give my readings in Celsius, but I've had people complain in the past, so we can do Fahrenheit if you prefer. Perfect. Okay. If you open up, lift your chin up high. Just open up, poking your tongue out slightly. That's it. Okay, good. We're just gonna hold it there for a second. Okay, good. So that's telling me, okay, you can close your mouth now. That's telling me 37 degrees Celsius, 98.6 degrees Fahrenheit. Okay, which is spot on, perfectly healthy, okay? Great. Okay, so when was the last time you had your blood pressure taken? A few months ago. Okay, that's fine. So, do you know much about blood pressure and how it works? That's fine, we can go through it a bit. So I've actually got a brand new device. Previously I've used a manual reading device with a dial, but I've actually got an electronic one now, so quite looking forward to using that. So your blood pressure basically refers to the force that your heart uses to pump blood around your body. So we're going to get a systolic reading over a diastolic reading. I'll show you. Okay, so I've got this electronic device. We'll get a number up here, which is your systolic reading. Here will be your diastolic reading. And down here will be your pulse per minute, okay? So your pulse is likely to be very, very similar to the heart rate that we just did. So a normal blood pressure reading would be about 120 over 80. High blood pressure would be 140 over 90. And then low would be 90 over 60. So we're looking to keep it as close to the middle as possible, which is going to be 120 over 80. So the top number is going to be the pressure of your heart when it's pushing blood around your body, and the bottom number is the pressure of your heart when it's resting between beats, okay? Okay, you happy with all of that? Okay, and I will plug it in to the cuff. So the cuff is just like a normal one. Okay, so if you pop out your arm, yep, this one, because then you can rest your elbow down on the table, that's fine. So I'll wrap this around, okay? When I press start, it's going to begin to pump up, okay? Perfect. That's it. Good, are you comfortable with that? Okay, I'm just going to plug it into the monitor and turn it on. So don't worry, it just takes a few minutes. Just make sure that your arm is nice and relaxed. Don't tense or anything like that, because that would give a bit of a skewed reading. Yep, so 122 over 84 with a pulse of 68 beats per minute. Perfect. That's actually really, really healthy. Okay? Yep, so if you just wanna, I'm just gonna release it and then you can just slide your arm out, okay? Perfect. Right then, what we'll do is I'll just pack this up and then we can move on to your eyes, your ears, your skin, and I've actually got a pulse oximeter for your finger as well, which we'll do next. okay? Alright, so have you ever used a pulse oximeter before? So it measures the oxygen saturation levels of your blood. You heard of it? Okay, no worries, so I'll just show you. I've got it in this cute little bag. Okay. So what this is gonna do, can you see it's gonna clamp on your finger like that. Now can I just check if you're wearing nail varnish like I am? If you are, then it doesn't actually work. So it's just, yeah, you see you haven't got any on. Perfect, because otherwise I would have to ask you to take it off, which is a bit of a nuisance. Okay, so it's gonna go on your finger like that. It's not tight, okay? It's just kind of a nice snug fit, and I promise it doesn't hurt. It's painless, okay? So then we'll press the button. So basically, that'll give us your oxygen saturation levels. This device has very tiny, small beams of light which will pass through the device and through your finger, okay? And it measures the amount of oxygen in your blood. So a normal range would be between 95% and 100%. So we wouldn't normally like to see any lower than that. It's quite rare and unlikely, so don't worry, most of the time it is around 98-99%. Okay? Yep, so if you just want to give me your index finger on either hand, that's it, perfect. Just pop it out and pop it in the device. That's it. Alright, let's turn it on. Yep, it's just gonna take a minute. Okay, so it looks like yours is good 98%, which is fantastic. Okay, good. You can just take it out. We'll turn it off. Okay, so those are your main physical checks. We did your heart, your lungs, your blood pressure, your pulse, your oxygen, and your temperature. So if I could just have a look at your eyes, if that's okay. I've got a flashlight, okay? So I'm just going to be having a look at your pupil dilation. They will dilate, get bigger and constrict, get smaller as I bring the light in and out, okay? This shouldn't be too uncomfortable. If you don't like to look at the light, you can look away, you can look at the black wall behind me, or you can look at my face. If you don't mind it, you can look at the light. It's up to you, okay? I just don't want you to get dazzled, okay? Good. Ready? So, if we do it one eye at a time, so if I ask you to close that one. Perfect. And we'll just have a look in this one. That's good. Perfect. Good. Good. Okay, if you look up. Good. Look up, look up, look up, look up. And look down. Look over to the left. stretch then. You can open that eye, close that one, and we'll just repeat that again. Good. Perfect. One more. That's it. And if you look up, just looking into your eye. That's it, and look down. Look over to the left. Look over to the right. And look center. Fantastic. Okay, if you just give your eyes a second to adjust, it can be a bit dazzling. Okay, so yeah, you can just close your eyes, blink, that's fine. Now, when was the last time you went for an eye examination? Okay, and what did the eye doctor say? Did they say that your eyes are healthy? Good. So we won't go through an eye chart today. I see that you're wearing glasses. Are you using your most up-to-date prescription of lenses? Perfect. Okay. So that's fine then. If we could check your ears. So what I'm going to do is look deep into each ear and just have a look to see if there's any build-up or blockage. Now, how do your ears feel? Do you tend to get earache? Do you tend to get quite blocked up with wax? Okay, so how often do you clean your ears? A couple of times a week. Okay, that's fine. That's fine. So if I have a little look, and I'll just see if there's any wax that needs clearing out. And if there is, are you happy for me to do that? Okay, so I would just be using a Q-tip. One of these, okay, so it's made of cotton wool and it's pointed on this end, flat on this end. Okay, so I'll just be using this one, the pointed end, just to give a little bit of a clean, but only if that's necessary, okay? Perfect. Alright. If you could turn your head over to the left. And I'm just going to shine the light in your ear so that I can see. Okay? Good. Just going to move your hair back out of the way. That's it. And then we'll have a look in your ear. So there is a little bit of wax in there, so I'm going to go ahead and do a little bit of removal with that, okay? Good. That's fine. Let's have a look in the other side. Okay, so that actually came out quite clear. So you had just a little bit of surface level wax, but nothing deep inside. So you've clearly done a very good job of keeping your ears clean and healthy. So that's good. Okay. Let's just have a look at this side. So if you could turn your head over to the right. Let's just move your hair back. That's it. So I'll have a look with the light. Okay, same again basically. Just a little bit of wax. Doesn't look deep, so I'm gonna just slowly take a second, alright, just to remove some of that. Just put the flashlight in the other hand. Okay, good. And that's it. Okay, well done. So, I didn't do your eyes and your ears in too much detail. Okay, we mainly have focused so far on your physical, your body. Okay, because you did say that you've been to an eye exam quite recently. And when was the last time that you went for a proper ear checkup and hearing exam? So about 4 months ago. Okay, that's fine. I would say around the 6 to 8 month mark, maybe start to think about booking in another one. Sometimes there's a little bit of a long waiting list, so if you book it nice and early, you can make sure that you get in well within the year. But your ears look healthy, and how would you say that your hearing is? I've spoken quite quietly today. Have you been able to hear me okay? You have? Okay. That's fine. We won't go through a hearing test today. So if you book one in, okay, and then they'll go through it in a lot of detail with you. But it's only necessary really if you think that there's any problems with your hearing, okay? Perfect. Alright, so we've only got a couple of things left. What I'm gonna do is check your skin sensitivity, which we'll do on your face if that's alright. So I've got 2 items. I've got a metal tool. It's actually it's perfectly clean, but it's a dermatologist tool, okay? And then I've got another Q-tip. It's a different one, don't worry. And so I'm going to be popping them against your skin, and I'd just like you to tell me which one you can feel. So if you have your eyes closed, this is cold and hard object, okay? It's not sharp, it's just cold and hard. And this is soft and slightly kind of fluffed up edges. It's not particularly cold or warm, okay? So hopefully you'll be able to distinguish between the two. Alright, so if you close your eyes, that's it, and just tell me if you can feel the Q-tip, or, well, this is a blackhead tool, the blackhead tool, or the Q-tip, okay? Good. Q-tip, yeah. And the metal metal tool. Good. The Q-tip. Good. Q-tip, yep, on your nose. If you could tell me whereabouts you feel it as well. The metal on your forehead, good. Q-tip on your bottom lip, good. Metal tool on your nose, perfect. Q-tip on your right cheek, good. And then one more. Metal tool on your chin. Okay, good, that's fine. So the reason we do that is just to check that your skin is able to distinguish between sensations, okay, which it is, so that's fine. I've just got a couple of things now, just to have a look at your shoulders and your neck. These areas are really, really important to check in a physical exam. And most of the time people hold a lot of tension in their shoulders and their neck, and it can lead to headaches, okay? So I'm just going to ask you to turn your head just gently left and right, okay? All the way to one side, all the way to the other. Did you feel any pain at all doing that? No, okay. If you lift up all the way high, okay, to look at the ceiling, completely moving your head upwards as far as you can. Okay? And then downwards so that you're resting your chin on your chest, okay? That's it. You should feel a light stretch at the back of your neck just then, but no pain or discomfort, I hope. Perfect, okay? And now tilt your neck from one side to the other. So you're going to be feeling a stretch down each side of your neck. Did you feel any pain or discomfort doing that? Okay. I would like to ask you to do that every single day, morning and night, okay? Just to keep your neck in good condition, nice and limber, nice and stretched and relaxed, okay? It can help to prevent tension and headaches, okay? Good, and now your shoulders. I'm not actually going to touch you, okay? Pop your hands on your shoulders and lift up high, and then drop suddenly, okay? So lift up again, big squeeze up, high as you can, and then drop. This is a good way to release tension in your shoulders, okay? Squeeze up and then drop. Good. Did you feel any pain or discomfort by doing that? Good, good. Right, so if you can rotate your shoulders backwards and then rotate them forwards. Okay, yeah, popping your hands on top is not necessary, but it does help a little bit. So rotate backwards, rotate forwards. Okay, lift up one, drop it down, lift up the other one and drop it down. Okay, how did that feel? Overall, any pain or discomfort or any tension? keeping them flexible, and it helps to again prevent tension and headaches. Okay, so again, that's fine. Did you have any further questions at all about your physical health or even about your mental health? No? Okay, that's fine then. If you do have any further questions, please don't hesitate to come back in, make an appointment, even just make a telephone appointment, or you can even just email the clinic and one of our doctors, perhaps myself, will get back to you, okay? But for now, I'd say that the exam is concluded and everything was healthy and everything was normal, okay? Perfect, and I will see you again perhaps in a year's time, or if you have any concerns before then, we may see you again before then, okay? Okay, lovely to meet you, and enjoy your day. Goodbye.